Hello, everyone. Good day to all of you attending, wherever you may be. My name is Raj, and I'm director of Mariwala Health Initiative, but I'm also an advisory board member of the Global Mental Health Action Network, who are the folks who've put these webinars together. So, welcome to this webinar. It is being recorded. In case you feel like tweeting what we are talking about, please use the hashtag MH4all, that is hashtag MH4all when tweeting. The session is going to last about 45 minutes. And in case you have any questions, please send them to webinars@unitedgmh.org, or you can just write them in the chat box. Before we start, let me tell you a bit about the Global Mental Health Action Network. It's an open community of mental health professionals. It has over 1,200 engaged members from over 90 countries, and it's the largest global mental health network of its kind in the world. It works collectively to accelerate political and financial support for global mental health through a range of activities on communication, advocacy, and thought leadership. The network also has some working groups on youth and child mental health, financing for mental health, and they're about to launch a few more working groups. So, for any one of you who would like to join or to find out more information, we'll be sharing details on how to reach out or how to join in the chat box. So, now on to today. This month, members of the World Health Assembly will be discussing mental health preparedness and response in public health emergencies. Why is this important? And what's significant about this year's meeting? Of course, it's not going to come as a surprise when I say that COVID-19 has had a devastating impact. And so there never has been a more critical time to discuss mental health preparedness. And of course, to shed some light on this, I'm very pleased to have the company of our esteemed panelists, who I'm going to introduce all of you to right now. We have Niall Boyce, who is trained in medicine at Oxford. He worked on the University College London Psychiatry rotation, and after that, he joined the Lancet as senior editor in 2010 before moving on to launch the Lancet Psychiatry in 2014. His interests include suicide research, trauma, old age psychiatry, and social and cultural aspects of mental health. I'm looking forward to hearing from you, Niall. We also have Nasri Omar. Unfortunately, we are unable to see her today on camera because her internet connection is problematic, but she is here with us. She is from the Ministry of Health in Kenya, and she is the focal person for mental health systems and services. She has a Bachelor of Pharmacy degree and a Master of Science in Global Mental Health. But currently, what she's doing is she's actively involved in the COVID-19 MHPSS response in Kenya. Her strengths lie in policymaking and coordination of national MHPSS activities. We also have with us Dr. Mark Ommeren. Sorry for butchering your last name. He is a public mental health advisor at the World Health Organization and the focal point for mental health and psychosocial support in emergencies. His job includes advising and supporting agencies in providing the best possible social and mental health supports to people affected by war and other such disasters. He's played a key role in initiating and drafting some documents that you all may be familiar with, such as the IASC guidelines and sphere. And finally, very excited to welcome Dr. Taiwo Lateef Sheikh, a professor of psychiatry at the Department of Psychiatry in the College of Medical Sciences at Ahmadu Bello University in Nigeria. Now, he holds many offices, and I will go past my time if I have to mention all of these. But most importantly, he is the president of the Psychosocial Relief Society of Nigeria and the chairman of Psychotrauma Working Group of the Association of Psychiatrists in Nigeria. He is also a member of the National Action Committee on Mental Health in Nigeria, where he participated in the revision of the mental health policy for Nigeria in 2013. Currently, he is working on the integration of mental health into the primary healthcare system, as well as leading the working group working on the Nigeria mental health legislation. So very excited to have you here. And I'm just going to jump in and start putting our panelists on the hot seat. I'm going to start with you, Mark. So Mark, if you can tell us what is the World Health Assembly and why is this year's assembly in particular so important for mental health and development? You're on mute, Mark.
Thank you, Raj, and thank you all for joining this session and being attracted to listening about the World Health Assembly. So I work for WHO. The World Health Assembly is the governing body of WHO. The World Health Assembly governs WHO. And each year it meets, and there's 194 member states, and their delegations exist out of the governments, combining the Ministry of Foreign Affairs and the Ministry of Health. And in 2013, it was this World Health Assembly that endorsed the well-known Mental Health Action Plan, 2013-2020. And last year, 2 years ago, it asked, it requested an extension of the plan till 2030. Now, this year's assembly is important because this year, next week, they will make a decision whether or not to adopt the updated plan. The updated plan is very relevant because, first of all, the indicators and targets have been updated. Of course, targets have to be reset with a different date, but also there's more indicators to get a slightly more refined look at what countries are doing in terms of progressing on mental health. And the second thing is that the action plan has considerably strengthened in the areas of children, in the area of mental health across the life course, public health emergencies, of course, because of COVID-19, human rights, suicide, including decriminalization, and digital health and workplace mental health. And of course, in WHO right now and in the global health right now, UHC, universal health coverage, is central, and there's much more language on that. Now, for those who are closely follow the World Health Assembly and look at the agenda, you will see mental health. There's mental health. You see it only once, but actually mental health will be discussed twice on the agenda. Once in agenda item 13.2, which is on NCDs. And in that agenda point, there's an opportunity for member states to review progress made so far on the mental health action plan in 2013, 2020. Then there's a second agenda item, which is agenda item 18, which is purely on mental health and COVID-19. And for a complex reason, that's also the agenda item that will eventually make the decision to whether or not to adopt the mental health action plan. We expect most comments by member states to be made there. I'll leave it like that for now. Thank you.
Thanks, Mark. That was a very comprehensive answer. It answered all of my doubts. So I'm going to shift to Niall. If you would, sitting where you sit, can you give us a quick overview of the current status of global mental health and why it's important to be discussing this, particularly in the context of global health?
Thanks, Raj. A quick overview in 3 minutes. Well, I think the best starting point is to say that the World Health Assembly's theme this year is ending the pandemic, preventing the next, building together a healthier, safer, and fairer world. I find that a laudable sentiment, but we have to consider that this is a world which has for a very long time been unhealthy, been unfair, and indeed been unsafe for people with mental health problems. Now, there are two aspects to think of here. The first is the extent of mental health problems globally. I'm going to pop some links in the chat in a moment, so I won't give lots of facts and figures, but I'll just give something as an illustration. If we look at the most recent global burden of disease study published in the Lancet last year with data from 2019, 3 conditions, depression, self-harm, anxiety, they were in the top 25 causes of disability-adjusted life years for all ages. And when we look specifically at the age range from 10 to 24 years old, these move into the top 6. So, you know, mental illness is common and it's widespread. How's the pandemic affected the picture? To some extent, it's too early to tell. We still have a bit of a road to go along to get out of this thing and to move into social, cultural, and economic recovery. The data from England suggest that there was a deterioration in the mental health of the population here back in April last year. People seem to be getting, by and large, better by October, but around 1 in 9 individuals still had what the researchers classified as deteriorating or consistently poor mental health. And this seemed to be linked to other adversities, such as financial problems. Depression and anxiety are the conditions here of particular concern. Is this the way it's going to play out in other settings worldwide, similar in different settings? We don't know quite yet. We shall see. Now, the second aspect to this question, why does global mental health matter, is to do with resource. Now, in brief, the amount of money that's spent on research, that's spent on treatment, and the quality and the quantity of services, these are all minuscule in proportion to the challenge which we face. So this was outlined a few years ago in the Lancet's Commission on Global Health and Sustainable Development. I have no reason to believe that the situation has changed substantially since then. So there's clearly a moral and an ethical case to be made for promoting global mental health, but I hope I've made it clear there's also a really pragmatic case to be made. At the moment, the situation is completely self-defeating. We won't have this healthier, safer and fairer world until we address mental health.
Thanks for that, Niall. Yes, absolutely. Not addressing mental health is such a driver of inequality. I'm going to shift to a country focus, and I'd love to hear from Nasri. What are the recent highlights from the mental health and psychosocial support COVID-19 response in Kenya? Niall spoke about England, so hopefully you can share with us what's going on in Kenya.
Thank you, Raj. So for Kenya, currently we are, maybe let me start with the development of guidelines. We've developed a couple during the beginning of the pandemic, but currently we are finalizing telemental health guidelines, which is a new concept for us, and also community health volunteers mental health manual, because of the need in the community to train the community health volunteers, because they are our foot soldiers, to be able to provide some basic intervention in mental health and diagnosis or screening. So, and secondly, we are still doing coordination of mental health and psychosocial support services in the country. The subcommittee, which was formed in the beginning of the pandemic, which for us was March of last year, is still operational, and the meetings are still taking place since March last year. And this coordination has a lot of partners, not just government, but NGOs and CSOs are also involved. Academia is also involved in this. The other thing that we've been doing currently is that we've actually virtually trained all our 47 counties on PFA, which is psychological first aid. We've also trained them on quality rights, and we've also disseminated a couple of the tools and guidelines we made for MHPSS. And here our target mainly has been mental health personnel or people who are working in mental health, or any healthcare worker who was interested to be trained on this. And this was successfully completed this just in April. We've also been working with UNICEF and Kenya Red Cross to provide PFA training, PFA psychological first aid for school teachers and children and child officers. So we're working on that, it's still ongoing. We've also rolled out a bulk SMS with information on psychosocial support, and it was sent out to the teachers to be able to get some basic information on what psychosocial support is all about. And the other thing which is about system strengthening is we are still working on establishment of a national telemental health center, which will also house our suicide prevention lifeline. We are also trying to map the mental health resources we have in the country in terms of human resource in all the 47 counties. This is still ongoing. We've just finalized our Kenya Mental Health Action Plan, and it's soon to be launched. And review of the National Suicide Prevention Strategy is also ongoing, and we are going to launch it hopefully by this year. The other thing, maybe which is a big, I think it just came at the right time for us, is that we are working with WHO and UNDP on in development of a mental health investment case for Kenya. And that has just happened. We just had our inception meeting on Monday. So this is something we are really looking forward to, because we'll be able to develop now coordinated and costed national responses now not just based on anything, but based on findings from cost-effective interventions, which have like high return on investments. So those are maybe just in brief what we are doing currently in terms of MHPSS support. Over to you, Raj.
Thanks so much, Nasri. This is really critical work, and it's inspiring for me to hear you and what you've been doing as I sit here in India. And one would hope for the same kind of response here. So thank you for all you do. Now, Taiwo, I know that you've worked a lot on integrating mental health into primary care as well as legislation. So, in terms of the policy bit, since you've been so involved in legislative change, can you tell us more about how you have achieved these legislative changes?
Well, thank you very much for this question. In terms of mental health care accessibility to people, you know, it relies on legislation and policy framework of the country. That is what will determine how people will be able to access affordable mental health care. In Nigeria, for the legislative aspects, it's been a huge challenge. The story of mental health legislation in Nigeria started since 1916 when the British colonial masters bestowed upon the country the Lunacy Act. And up till now, we are still using the Lunacy Act of 1916. It became a Nigerian law in 1959 when regional governments absorbed it to become regional laws. For over 35 years now, various groups of people have been trying to change the mental health law in Nigeria since the early 90s. And we are still on it. It's still not yet over. However, we have been able to raise awareness about the mental health law, how archaic and how it doesn't actually speak the modern mental health language. We've been able to do a lot of advocacy through the Association of Psychiatrists in Nigeria and all the mental health workers in Nigeria. We've taken it to the executive and the national assemblies. And now I think attention is being paid to revision of this law. Presently, we have developed a draft bill where we brought in all the stakeholders that have anything to do with mental health in Nigeria, including service users. They all had an input, so we developed a draft bill to revise that law. The draft bill is within the National Assembly at the moment. It has gone through 3 readings at the upper chamber, which is our Senate, and they have passed it after public hearing. We are hoping that the lower chamber, which is the House of Representatives, will be able to concur with what the upper chamber has done, and then they will move it to the presidency to sign it into law. That will be a huge change in terms of mental health care service delivery in Nigeria, because that will completely eliminate a lot of things, especially things that have to do with human rights abuses regarding mental health in Nigeria, bring service to the doorsteps of people. Our mental health policy that we are using today is the 2013 mental health policy, and is hinged on the integration of mental health into primary care. But there is no law that will force government to do that. So we hope that if this law is passed, the mental health sphere in Nigeria will change.
Thank you, Taiwo. All the very best, and I hope the change comes soon. Listening to you, of course, you know, we have a shared history with the Lunacy Act, and in India, we had the change in 2017 with our Mental Health Care Act. So my very best wishes for that. I'm going to swing back to Mark. And Mark, if you could tell us about this year's World Health Assembly and COVID-19 and mental health. What do you expect is going to happen in session which has agenda item 18? And what are the opportunities within that?
Well, it's the first time ever that there will be an agenda item on mental health and emergencies at the World Health Assembly. And what do I expect to happen? well, this is an advocacy network. So we're talking here, I'm talking to people listening here are advocates for mental health. So this is important because in the assembly, member states will be making statements on mental health. And they don't have to, it's optional. But we have a suspicion that there will be many, many member states who will like to make a statement because it's important to them to talk about mental health and COVID-19. They don't want to be quiet. That's what we expect. And many of them will do two things. They will be saying some of the things that they're doing. They will be probably validating the need for action in it. They will be saying what they're doing. And some of them will be making requests for work to be done. And some of them will be making commitments. Now, these statements can be they are the prerogative of the member state, of the government, to make them. But my understanding is that many people on this webinar are interact regularly, or may not work for government, interact regularly with government, and often advise government. So there is an opportunity to interact and to work together, potentially, if the governments are open to it, to make a very strong statement. Now, the statements tend to be are on the record. So from an advocacy point of view, if one is a strong advocate, one can imagine that one looks back at these statements and uses this for advocacy within one's country. So there's an opportunity here. And we expect a very vibrant session, as we have reason to believe that, because there was a shorter session of this at a smaller group of member states earlier this year, the executive board, and a lot of member states spoke lengthy and much longer than perhaps planned in the agenda. So we look forward to it, and we hope that this will further bring, as part of the many steps that we have to have more energy and more commitment for mental health.
Thanks, Mark. Hoping for the best there. But if I could ask Niall, now, as editor of Lancet Psychiatry, you've worked, your journal has published so much on how COVID has affected mental health globally. Now, from a science perspective, what are the kind of actions that countries should take to address mental health in the context of the pandemic?
Thanks. Well, the first thing we need is better data. The Lancet Psychiatry recently published a report on the relationship between the pandemic and suicide rates. Reassuringly, it showed that there did not appear to be a rise in suicide rates following the outbreak of COVID. Perhaps less reassuringly, all of the data came from high income and upper middle income countries. Now, I'm not saying that suicide rates are the bellwether or the be all and end all of mental health data, but if we don't have basic data like this, it's very hard to formulate anything like a coherent response. So second, I'm led here by the work of Dr. Lola Kola and her colleagues, who published a paper on specifically the subject of global mental health in the context of the pandemic in the Lancet Psychiatry. And they have many fantastic recommendations in that paper, which I'll paste into the chat box in a moment. They recommended fully integrating mental health in plans for universal health coverage. They also recommended accelerating the sorts of changes we've been talking about for years in global mental health. So task sharing with psychosocial interventions, also really leaning on digital interventions. To go back to my earlier answer, if anxiety and depression are indeed the big problems in this pandemic, well, we have the tools to deal with them that CBT we know works, and that can be delivered through psychosocial interventions, that can be delivered through digital interventions. We've got the tools, we can do the job. Beyond this, though, I think we need to think a bit beyond crisis response, and maybe global mental health needs to consider the end game a little more. What would a robust and a sustainable mental health system look like in every setting? How do we get there? And then there's the overarching issue, which is that we really need a shake-up in the traditional power structures and hierarchies of mental health. I don't just mean between countries, I mean within the system in terms of the voice of people with lived experience. Now, if we do a piece of research these days, researchers have mechanisms for ethical approval, they have mechanisms for pre-registration of their studies. No such standard mechanisms exist for the inclusion of people with lived experience. Perhaps it's time that we thought of that, and not just in research, but also in service planning. Finally, there are a few topics which people were talking a lot about a year ago, which seem to have evaporated since then. These include using the psychological sciences to enhance the pandemic response, for example, in communicating information. There's still maybe a bit of time in which we can gather those data, and that would be, of course, extremely useful in the event of future pandemics.
Thanks, Niall. I'm going to catch on to my favorite part of what you said, that we need to challenge some of the power equations. And of course, persons with lived experience is a critical part of that, but so are civil society advocates. So Nasri, if I may ask you, in Kenya, you have a strong relationship with civil society advocates. How do you think civil society can work with and influence health ministries?
Thank you, Raj, for that. So for us, what we've done in Kenya is that every technical working group that we form for development of policy, plans, guidelines, manuals, review of legislation, we have a representation from a service user organization. And this we started from 2019 when Kenya also adopted the Quality Rights Initiative. So that is something which has really helped us in the Division of Mental Health. And we are representing, before we would invite them even for validation meetings, but we came to find out that's not enough. We want to be involved from the start when we're having the ideas of what we want to develop, and we get their input from the beginning up to the end. And the second thing is that we would also ask if they would want to collaborate with the ministry. They can do it through a memorandum of understanding, get the ministry on board on what their project is. But this one, mainly, if you have an MOU, it's mainly for long-term projects that you want to work together on. But for something maybe short-term or projects which are just a few months, what they've been doing is that they've been requesting the ministry officially, doing letters, requesting to collaborate, and they would follow up and come and see even the minister. They get the audience, and say that they want to collaborate with us. And that will be sent back to us to see our input on it at the division. Is this a partner you're aware about? Do you want to partner with them? So that has been really helpful because we wanted them to also follow the official channels. The other thing is also, especially in legislative reviews, which are happening in many countries like Kenya right now, we still have our mental health bill, which is in parliament. So we just encourage them to attend and contribute to these meetings. This is at legislative level, not at our level, but this will influence the Ministry of Health in one way or another. And they submit memorandums to different organizations and task forces which are formed, not just only on things which are specifically on mental health, but we can have laws or policies which are formed by other ministries which relate to mental health, like in for social protection, labor, Ministry of Education. So those are the things that we actually recommend that they contribute actively, they engage in public hearings, if any is planned for, and they also engage, and we also invite them to all our validation meetings. Other than the members, we can't get all the service user organizations. So we usually take the umbrella organization. And what we do is for the others who are not able to be in the technical working group, we invite them for the validation and stakeholder meetings. And that's what we've been doing so far. We also work with them a lot on commemoration of the international days like Mental Health Day. Most of the time it's them even who run the show and run the program. And we just show up to just collaborate with them on it, and we support them with any letters of support that they require. Also in terms of research, if CSOs want to carry out studies or they're applying for grants, they ask for letters of collaboration from the Ministry of Health. And because as for us, we've already developed a relationship with them, it's easier for them to get those letters. I think that's all from my side. Over to you, Raj.
Thanks, Nasri. That's really powerful and extremely exciting. I'm going to look up more on what Kenya is doing later. I'm going to switch now to Taiwo. And what do you think, Taiwo? What are the main opportunities or priorities for change in Nigeria? And what do you think has the most chance for success in Nigeria in mental health and the COVID-19 response today? Taiwo, I'm afraid you're on mute.
I'm sorry. I still think in general terms regarding mental health, before I come down to COVID-19, is to have a framework as being, encouraged by WHO to be able to govern properly regarding mental health. And in terms of governance, of course, you need the legislation and the policy. They are very key. So the most pressing activity that I would want to see that will come through, that will also improve whatever we are doing for COVID-19, is to get the mental health legislation done in Nigeria and to revise the mental health policy of 2013 and develop a strategic plan for it. The legislation will ensure adequate implementation of the policy and the strategic plan. For COVID-19, a lot has been done. Our approach, we actually published something on national preparedness for COVID-19. And recently I spoke with officers of the Federal Ministry of Health on working on how we can address the mental health issues related to COVID-19. I think the government is awake to that now, and they are formed some committees for COVID-19 related to mental health in Nigeria. At the beginning of the COVID-19, we worked with the NCDC to develop short messages that are related to mental health. Messages that will address fear, anxiety, messages that will address mental health issues that are common among COVID. And then we also had the entire mental health professionals in Nigeria. We came together and formed a group, and we called the group Mental Health Professionals for COVID-19. And we were able to develop strategies for remote consultation, free call lines for people who have COVID and are having mental health issues, or people who have mental health issues and could not access treatment facilities because of lockdown. We were also able to develop remote training for psychologists, for lay workers, to be able to address issues that come with mental health during COVID. So in Nigeria, this is what we have been doing, and we are still on it. We've been able to get some toll-free lines for people to make calls, and they get response for those who have issues with COVID, especially because of the lockdown that restricted movement, didn't allow people to go to hospitals. Those who have previous mental illnesses could not access follow-up and treatment, and we were able to do that. Yeah.
Thanks so much, Taiwo. That was a comprehensive answer to my question. Now, I've had my chance to ask you all many questions, and I think I better open it up to everyone who's joined us today for questions. And what I'm going to do is I can ask you to ask in the chat box if you do have questions, but what I will do is I'll start off with the questions we already have currently. So Elizabeth asks, hi Taiwo, thank you for that overview. Are you able to share a few changes that would be part of the new legislation? You mentioned integrating mental health into primary care services. Are there any other notable changes that are on new legislation that you could please highlight for us? You're on mute, Taiwo.
Sorry. Very, very significantly, we realize that the Lunacy Act does not address modern mental health issues. In fact, there is nothing called mental health in the Lunacy Act. That language is not there, completely absent. So it's something that completely cannot be used for human beings in this era. And because of that, what we have is not just a revision. We have a new mental health legislation altogether that is looking at the human rights of mentally ill people, that is looking at access to treatment and care for mentally ill people, that is looking at addressing mental health, funding mental health the way other health conditions are being funded in Nigeria, that is laying responsibility of care, of support to specific groups within our communities, that will try, that is addressing the issue of stigma and discrimination that mentally ill people are facing. That is also looking at some of the traditional value system relating to mental health in Nigeria, so and so on and so forth. What we actually do is a completely new mental health law, because the Lucy Act is not useful, cannot be applied completely. So that's what I hope I've been able to answer her question, but that's what we have done.
Thank you so much, Taiwo. I'm going to ask a question to Mark, and I know that Mark answered it in chat, but I think it's important that everyone hears it. Buffa Washington from Liberia asks, how can the Assembly hold member states accountable for the statements made at the Assembly, especially as they relate to investing in mental health and supporting mental health policies?
It's a very good question. So the Assembly doesn't hold people accountable. It's not like it's not a police. It's not, and WHO is not a police. I mean, it's nothing like that. No country will agree to that. But what happens is that the Mental Health Action Plan has mandated WHO to monitor progress that countries make on mental health. And we make a report every few years called Atlas. So the Atlas report shows changes over the years from countries. And now we have more indicators. So we will have future years, especially interesting atlases. So when someone makes a commitment and then one later sees that that commitment isn't made, then there is a role for advocates, an opportunity for advocates. But accountability will then not come from the World Health Assembly. It has to come from people in the countries.
Thank you so much, Mark. There are quite a few more questions for you, Taiwo, on the legislation in Nigeria. And if you can just share, I'm going to combine them into a larger question. One is, what are the main issues that have been preventing progress on the development of the legal framework in Nigeria? And why is now the time that change is possible? And finally, if you could share the legislation language and how the language can be helpful is by having other countries know what sort of language to use when drafting legislation.
Oh, thank you very much. I needed to check that I'm not muted anymore. Well, the challenges has been quite enormous, like I said, with the background of the stigma towards mental illness, the lack of political will by the previous governments to address mental health issues in Nigeria. So wherever you go, you knock on the door, nobody will open the door for you. People, the attitude towards anything that has to do with mental illness has been very, very discriminative, even among professionals, health professionals. So these are the challenges of funding to be able to even do advocacy, to move around, to get some resources to move around to do this advocacy has been very, very difficult in this part of the world. So these are quite a number of challenges that we have faced. If you now ask me why now? Now, because we've been able to do a lot of awareness campaign all over. We have now the social media. We've taken advantage of the social media and to use the social media for awareness for mental health. And we were running all this awareness campaign on the TV, on the telephones, on the Twitter, Facebook, everywhere, anywhere. And we were also running conferences and workshops in different parts of the country, raising awareness on what is mental illness all about, and then why do we need mental health legislation. So this has helped us and has actually caught the attention of the politicians. And then among them, we have a democratic government now, so they are quite approachable. We now have some senators and legislators who have taken interest in on the issues of mental health in Nigeria. We have the chairman of the Senate Committee on Health, Senator Oluri Egbe. He has taken it as a personal challenge to see that mental health legislation is put through. And we are mounting pressure on him. He's our friend, and he has shown us that he wants to get this thing done. We also have another legislator in the Federal House of Representatives who has also taken interest. So we don't want these people to go their tenure to end without getting this thing done. So if you ask me why now, this is the best time for us. This is the greatest opportunity we have with these legislators, with these people in the executive who are interested in changing, the story of mental health in Nigeria. Then when you talk about the language, well, it's difficult for me to give you the entire language, but we have a WHO document on mental health legislation, which has about 11 points, guide on the language, the process you use to develop mental health legislation for your community. We found that very useful. We found it a very useful resource, which we use as a guide, now adding our own cultural aspects to what we got from the WHO. So I can send you reference on the WHO 11-point guideline on developing mental health legislation for your country. And that will give you the best language to use. But you have to now look at your own cultural, traditional, practices that will not be, against what you have there, and use it to do it. But specifically in this country, we realize that the lunatic law is very, very inhumane. It's inhumane, it's discriminative, it's something you cannot use in modern day. So we petition it entirely. There is something in that lunatic law that is coming into our mental health law. So that's what I will send you the WHO reference on the 11-point developing mental health legislation for your country. I hope I've been able to address the questions. Thank you.
Thanks so much, Taiwo. I know I combined all of them into one, and that must have been hard. So thank you. Along a similar vein, Mark, if you can answer Advocate Syed, who's writing to us from Kashmir, how can non-state stakeholders be part of the World Health Assembly? And what is the role that they could play? Sorry, Mark, you're on mute.
I got it. The WHO has official relations. I mean, it's all planned for, right? So WHO has official relations with a number of NGOs. They're called non-state actors, and so it's the NGOs. They make statements through the ones that are officially in official relations. A very well-known NGO like that is the World Federation for Mental Health, which in itself is again a group of hundreds of, maybe more than hundreds of organizations. So so one way is to make a statement to the World Federation Mental Health. The same thing is true for many of the professional organizations that are in official relations, like the ones for psychology, International Union, Psychological Sciences, the World Psychiatric Association. There's a variety of them. Then there's a few large NGOs in official relations, like Save the Children, International Medical Corps, World Vision. So there's a variety of ways of inputting, and it's important. I mean, it's challenging, of course, bring all these different points together and make resolutions, because in the end there's resolutions, and the resolutions, the only ones who vote are again the member states, because the member states govern WHO as they govern the UN.
Thank you, Mark. I must ask this question. I see that a friend of mine, Joshua from Sierra Leone, is attending. Hello, Joshua. Long time no see. But anyway, Joshua's question. We are having this concern in Sierra Leone that if the Act places huge structural and financial demands of our national government, members of parliament are going to be skeptical to pass the law. Was this a situation that you faced, Taiwo, or maybe Nasri can also talk about it? If yes, how would you overcome it? I invite any and all panelists who wish to answer this one.
Well, I can make attempts partially. Yes, the law, makes the government to get committed to implementing certain aspects. And it's that commitment that government is running away from. And the commitment has to do with funding and also has to do with certain basic human rights of individuals who have mental health issues. But most importantly, the issue of funding. They will tell you where will the money come from. They're already working on a very tight budget. So the major thing in getting that law passed is it will force governments to do certain things, which they may consider very difficult to do. It's one major thing that I can see. I believe other people could have things to add.
I think that part of this is moving away from the language of plugging a gap and towards the language of investment. And that if you are spending money on mental health, you are not just dealing with a need, but you're actually investing in the future of your society.
I think I agree with the previous two speakers. I think that legislation and policy works best when there is a budget commitment with it. So that it's tricky because sometimes if you add the budget commitment, then you may not get it passed. On the other hand, if you pass something that is perhaps not realistic within the budget of the country, then it remains a piece of paper. So there should be some tension. It should be ambitious so that people can reach it, but it shouldn't be it shouldn't be literature that people can just read it but it's not applicable anymore. And I think but it needs to be some tension. It has to be ambitious, and of course it has to protect the rights of people. In legislation, the first part of legislation is protecting the rights of people. That's where it starts with.
Maybe I can just add something which is happening in Kenya is that the mental health bill I spoke about has been in Parliament and Senate since 2018. And it's 2021. And the challenge we had is it was referred to as a money bill. So as people have said, it brought a lot of resistance. So we are still working on it, but now we are trying to put it in ways that it doesn't come out as a money bill. I think trying to make it smarter the way we had put it earlier. And we're also asking for a specific fund for mental health within the law. So yes, we are being very ambitious. Hopefully it will work this time around. And the other thing is that Kenya is working on the mental health investment case. And that for us is our advocacy tool. And hopefully we'll have that, the report of the investment case by the end of this year. So that is the advocacy tool we really want to go with to Parliament and Senate and make sure that for them to understand why we need to put a mental health fund within the law. Over to you.
Thanks, Nasri. Now that I have all the panelists here, I'm not going to let you go as yet, because this was such a great question and all of you provided fabulous inputs. I'm going to push you all some more. And I would love to hear from you a tweet length answer to how should advocates persuade mental health ministers to prioritize mental health? Can I put you on the hot seat first, Mark?
Oh dear. in a tweet like, how should advocates do it? I think is to speak to the value of mental health has in the human condition. It sounds very theoretical, but in a tweet like would be to I'm not a communications person, but anyway, I would put I would find language around the mental health as a core value of all human beings, and to investing in mental health is to value human life.
Thanks, Mark. Thank you. And sorry.
Well, if I may add, advocates need to be able to break down the language in a way that people who are policymakers and in governance will understand what we are talking about, and use local, examples, local situations to drive in the message of what mental health is all about and the need for investing in mental health, and letting people know how such investment in mental health could yield huge results. So we need to get grassroots, community level advocates that will be able to transform whatever we are saying here into local, means of understanding by the people. And the more people that understand what you are talking about, the better chance of driving a change regarding to mental health as it is today. I think this is another way that you can look at it.
Thank you, Taiwo.
Well, I've been very interested in this discussion, which is so much set in the present and in the pandemic, that we keep coming back to the troubled past of psychiatry and of mental health, in terms of legislation, in terms of care. And it reminds me of that sentence by James Joyce, that history is a nightmare from which I'm trying to awake. I think that meaningful mental health reform will address historic wrongs, it will meet the needs of people in the present, and it's substantial positive investment in the future.
Thanks, Niall. I'm going to call on Nasri, if you could.
Yeah, so in terms of advocacy, I think high-level advocacy, probably getting champions within parliament, within the executive. I know it's maybe difficult sometimes to reach the high-profile individuals, but these are the best people who can be advocates. For us, even the mental health bill, for it even to reach parliament, is because we have a senator who's very passionate about it. She's actually the sponsor of the bill, Senator Sylvia Kasanga. So that is very important. And maybe one comment that I just wanted to make is there's a lot of political will, there's a lot of donor commitment towards mental health. But if we don't translate this to actual resource allocation, then we're just going around in circles. So I think that's because the commitment has been there since the beginning of the pandemic, that you're seeing there's a lot of people who are coming on board and they're passionate about mental health and they're saying they're committed, but we need actual resource allocation towards mental health. Over to you, Raj.
Thank you, Nasri. I'm going to end on that powerful note because we can never forget that. Otherwise, it's all going to remain paper tiger work. So I'm going to wrap things up. Thank you all for joining us for this really important discussion. Now, the recording and the notes of the session will be posted on the United GMH website shortly. The next webinar in this series is on the 29th of June. Information on this will go out soon, so bookmark your calendars, and we hope to join. We hope that you are able to join us for that. But for now, I'd like to say a big thank you to all the panelists for answering so patiently and for this fabulous discussion. Thank you, everyone, and have a good evening.
Thank you. Bye.
Thank you. Bye.